Which of the following is not recommended in psychotherapeutic treatment of patients with borderline personality disorder? A. The therapist is a passive listener. B. The patient and therapist mutually develop a hierarchy of priorities. C. Clear roles of patient and therapist are established. D. Mutually agreed limit setting is used. E. Concomitant individual and group approaches are used. The answer is A. Guidelines for treating people with borderline personality disorder from the American Psychiatric Association (BPD). The recommended courses of action for treating BPD patients are listed in Table 26.1. Both the patient and the therapist experience difficulty during psychotherapy, thus both should be ready for this. A pervasive pattern of grandiosity, lack of empathy, and need for admiration suggests the diagnosis of which of the following personality disorders? A. Borderline. B. Narcissistic. C. Paranoid. D. Passive-aggressive. E. Schizotypal. The answer is B. Criticism either has little effect on narcissistic personality disorder patients or causes them to feel angry or ashamed. Rigidity, hypersensitivity, unfounded suspicion, jealousy, envy, and a propensity to place blame on and attribute malicious intent to others are all symptoms of paranoid personality disorder. Traits that have been identified as forming the stylistic components of behavior known as temperament include all of the following except A. Harm avoidance. B. Novelty seeking. C. Persistence. D. Reward dependence. E. Shyness. The answer is E. Harm avoidance, novelty seeking, reward dependency, and persistence are classified as temperamental qualities. These four temperamental characteristics are intimately linked to the four fundamental emotions of fear, avoidance of danger, anger, seeking novelty, attachment, reliance on rewards, and ambition, persistence. The defense mechanism most often associated with paranoid personality disorder is A. Splitting. B. Projection. C. Isolation. D. Hypochondriasis. E. Dissociation. The answer is B. Patients who suffer from paranoid personality disorder externalize their own feelings and blame others for actions and thoughts they are unable to accept within themselves. Hypochondriasis enables the afflicted to secretly punish others with their own suffering. Being alone enables a person to confront upsetting circumstances without being affected or affected by them. Which of the following biological factors pertaining to personality disorders is true? A. Smooth pursuit eye movements are saccadic in persons who are introverted. B. Low platelet monoamine oxidase levels have been noted in some patients with histrionic personality disorder. C. Compulsive traits are associated with high levels of testosterone. D. Antisocial personalities may have fast wave activity on electroencephalography. E. 5-HIAA levels have been found to be high in suicide attempters. The answer is A. Oftentimes, qualities that are impulsive rather than compulsive exhibit high levels of testosterone, 17-estradiol, and estrone. In some patients with personality problems, electrical conductance changes on electroencephalography, EEG, take place. True statements about diagnosing specific personality disorders include A. The diagnosis may not be made in children. B. Antisocial personality disorder may be diagnosed in individuals younger than 18 years of age. C. There is a potential sex bias in diagnosing personality disorders. D. Real gender differences do not exist in the prevalence of personality disorders. E. None of the above. The answer is C. Clinical evidence suggests a possible sex bias in personality disorder diagnosis. Several illnesses are diagnosed in men more commonly and women less frequently. Because of social assumptions concerning gender roles, therapists are advised not to overdiagnose or underdiagnose specific personality disorders. Borderline personality disorder is associated with A. A decreased risk for psychotic symptoms. B. An increased risk for premature death. C. A decreased risk for other coexisting personality disorders. D. A decreased risk for bulimia. E. A decreased risk for post-traumatic stress disorder. The answer is B. An elevated risk of suicide and self-harm is a feature of borderline personality disorder. Depression, substance addiction or dependency, eating disorders, post-traumatic stress disorder, and attention deficit or hyperactivity disorder may all be linked to the illness. It may result in lost employment, interrupted education, and shattered marriages. Antisocial personality disorder is associated with an increased risk for A. Anxiety disorders. B. Borderline personality disorder. C. Major depressive disorder. D. Somatization disorder. E. All of the above. The answer is E. Antisocial patients are at increased risk for impulse control disorders, major depression, substance abuse or dependence, pathological gambling, anxiety disorders, and somatization disorder. The most common co-occurring personality disorders are narcissistic, borderline, and histrionic. True statements about paranoid personality disorder include A. It may be a pre-psychotic antecedent of delusional disorders, paranoid type. B. The disorder is not complicated by brief psychotic disorder. C. Patients are at decreased risk for major depression. D. Impairment is frequently severe. E. All of the above. The answer is A. Delusional disorder of the paranoid kind is thought to have a pure psychotic antecedent known as paranoid personality disorder. Schizotypal, schizoid, narcissistic, avoidant, and borderline personality disorders are the most frequently co-occurring personality disorders. Persons with narcissistic personality disorders. A. Are easy to treat. B. Handle aging well. C. Are unlikely to feel depressed. D. Are usually immune to criticism. E. May benefit from a psychoanalytic treatment approach. The answer is E. Narcissistic personality disorder sufferers are treated by Hines-Kohut using psychoanalytic methods. Patients are prone to sadness, troubles with their self-esteem, and low self-esteem for their own appearance, and they must give up their narcissism in order to grow. True statements about the aspects of personality called temperament include all of the following except A. They are heritable. B. They are relatively stable in time. C. They are inconsistent in different cultures. D. They are observable early in childhood. E. They are predictive of adolescent and adult behavior. The answer is C. Harm avoidance, novelty seeking, attachment, reward dependency and persistence have been named as the four main temperamental characteristics. It has been frequently demonstrated that these four characteristics are shared by all cultures, ethnic groups, and governmental structures. The etiology of borderline personality disorder involves A. Childhood trauma. B. Vulnerable temperament. C. Biological vulnerabilities. D. Familial aggregation. E. All of the above. The answer is E. In comparison to the general population, relatives of probands with this disorder have a prevalence of borderline personality disorder that is 5 times higher. Increased familial risk for antisocial personality disorder, substance misuse, and mood problems are also linked to the condition. It has been frequently shown that borderline personality disorder is inherited. Otto Kernberg's borderline level of personality organization involves a lack of anxiety tolerance, b. a blurring of boundaries between the self and other, c. is centered around splitting, d. alternating perceptions of the self and other as all good or all bad, e. all of the above. The answer is E. It is distinguished by generalized ego weakness symptoms, such as a lack of impulse control and an inability to tolerate worry. There are particular ego flaws, including a hazy dividing line between the self and the other. Defense mechanisms. A. Are unconscious processes. B. Are implemented to abolish anxiety and depression. C. Are used to resolve internal conflicts. D. In personality disorder patients are often rigid and intractable. E. All of the above. The answer is E. Defense mechanisms are unconscious processes used to resolve the conflicts of our inner lives. When they are most effective, especially in those with personality disorders, they can abolish anxiety and depression. Thus, abandoning a defense increases conscious anxiety and depression. Patients with personality disorders may be characterized by their defenses, which are most rigid and intractable. Mr. S. was a 45-year-old Postal Service employee who was evaluated at a clinic specializing in the treatment of depression. He claimed to have felt constantly depressed since the first grade without a period of normal mood for more than a few days at a time. His depression was accompanied by lethargy, little or no interest or pleasure in anything, trouble in concentrating, and feelings of inadequacy, pessimism, and resentfulness. His only periods of normal mood occurred when he was home alone, listening to music or watching TV. On further questioning, Mr. S. revealed that he could never remember feeling comfortable socially. Even before kindergarten, if he was asked to speak in front of a group of family friends, his mind would go blank. He felt overwhelming anxiety at children's social functions, such as birthday parties, which he either avoided or attended in total silence. He could answer questions in class only if he wrote down the answers in advance. Even then, he frequently mumbled and could not get the answer out. He met new children with his eyes lowered, fearing their scrutiny, expecting to feel humiliated and embarrassed. He was convinced that everyone around him thought he was dumb or a jerk. The best diagnosis in the patient above is A. Adjustment disorder with anxiety. B. Avoidant personality disorder. C. Schizoid personality disorder. D. Schizotypal personality disorder. E. Social phobia. The answer is B. An avoidant personality disorder is the best diagnosis. An individual with a personality problem may additionally have an adjustment condition. The symptoms of schizotypal personality disorder include weird or abnormal conduct, derealization, magical thinking, and strange ideas. An irrational dread of speaking and eating in front of others is known as social phobia. A 33-year-old woman presents for psychiatric evaluation after making suicidal threats. She reports a long-standing pattern of self-mutilation, impulsiveness, and no relationship lasting longer than 1 month. Which of the following is the most likely diagnosis? A. Histrionic personality disorder. B. Antisocial personality disorder. C. Narcissistic personality disorder. D. borderline personality disorder. E. None of the above. The answer is D. An ongoing pattern of impulsivity, irresponsibility, shaky relationships, and suicidal and self-destructive acts is a hallmark of borderline personality disorder. Exaggerated emotional outbursts, attention-seeking behavior, and frequently seductive behavior are all symptoms of the histrionic personality disorder. Directions. Each group of questions consists of lettered headings followed by a list of numbered statements. For each numbered phrase or statement, select the one lettered heading that is most closely associated with it. Each lettered heading may be selected once, more than once, or not at all. A. Paranoid personality disorder. B. Schizoid personality disorder. C. Schizotypal personality disorder. It is most similar to schizophrenia. The answer is C. Schizotypal personality disorder. Patients tend to attribute thoughts that they cannot accept in themselves onto others. The answer is A. Paranoid personality disorder. An enormous amount of effective energy is invested in non-human interests. The answer is B. Schizoid personality disorder. It is frequently diagnosed in females with Fragile X syndrome. The answer is C. Schizotypal personality disorder. Patients have the normal capacity to recognize reality. The answer is B. Schizoid personality disorder. Patients pride themselves on being rational and objective. The answer is A. Paranoid personality disorder. Disorders of the unusual or eccentric personality cluster A, long-standing suspicion and mistrust of people, in general, are characteristics of the paranoid personality disorder. In terms of peculiarities in perception, thought, behavior, and personality problems, schizotypal personality disorder resembles schizophrenia.